Okay, so I have reviewed the physician's order for my patient Mortuary, Fin 999-888-777, and I'm in his room. My overbed table is clean. I've gathered all my supplies. I have Damar with me. Hello, sir. My name's HongYang Lin. I'm a student nurse. Can I just compare wristband with Damar? Okay, Mortuary, Fin 999-999-888-888-777-777. Great. Mr. Chueri, I'm here because I'm doing an abdominal incision wound care on you. That includes removing the old Mefix, removing the old 4x4s, removing the old roller kerlix, and I will be irrigating, cleaning the periwound skin, packing and putting on new 4x4s and new Mefix. Is this all okay with you? He says, yes, it is okay. Before we get started, would you like some analgesia, some pain medication? He says, yes, he does. So I give him his PRN 50 mcgs of fentanyl. I wash my hands and I set up my sterile field. I'm going to add in 2x2s and 4x4s. Next, I'm going to add in my 30cc syringe and my cathlon. I have let this enter into my 1-inch sterile field, so I will be sure to be more careful in future practice. I'm going to add in my cotton-tipped applicators. I'm going to add in my roller kerlix and sterile scissors. And the final thing I'm going to add in is my normal saline. As I wash my hands and put on my clean gloves, I'll be removing the Mefix from the old So on the 4x4s and the Mefix, there's a moderate amount of reddish pink serosanguinous drainage, and it has a small amount of odor to it. On the old roller kerlix, there's a moderate amount of reddish pink serosanguinous drainage, and it has a small amount of odor to it. I wash my hands, and then I put on my sterile gloves as I prepare to So I have at least 10 cc's of normal saline, and I also have my cathlon attached, and I'm going to irrigate from top to bottom, only the incision area, avoiding periwound, only the incision area and avoiding the periwound, and I'm going from top to bottom. And in a real clinical setting, I would keep on irrigating until it runs clear. I've used up all 10 cc's, and now I get my 2x2s and 4x4s, and I fold it in half, and I dry the inside incision. My sterile hands are still sterile because it didn't touch the wound. My sterile hands are still sterile, and now what I do, here's my silver forceps. I get a 2x2 and make a rosette. And I dry it. And now I wipe from top to bottom the periwound. One swipe top to bottom, discard of it. And now I'm going to do the right side periwound. Discard of it, and then now I'm going to dry it. So I'm going to get 2x2 rosettes. left side dry top to bottom. And now I'm going to get 2x2 rosettes on the right side. Dry the periwound from top to bottom. Discard, and now I will be assessing the wound just by looking at it. It is reddish pink granulation tissue on the secondary intention, and that's how the wound is healing. And the periwound skin is dry and intact, but it is reddened. So I will now get my cotton tipped applicators and I will measure dimensions of the wound. There's a height of 15 centimeters. There's a width of 4 centimeters. And there's a depth of 3 centimeters. Discard of it. And now I'm going to go around the circumference and try to look for any tunneling and undermining. Okay, so as I went around the circumference, no tunneling and no undermining was noted, and now what I will do is I will get my roller kerlix and I will pack it. So I've wringed out some of the normal saline, so it's not super wet, it's only moderately damp. And I'll pack from top to bottom, making sure to fill in the entire abdominal incision area. And my cotton tipped applicator is still sterile because it's only touching the roller kerlix. In real clinical practice, my roller kerlix touched a small amount of the outer periwound skin, and I'll make sure to not let it touch the periwound skin anywhere near as much, because and it looks like it is fully packed. And I'll cover the top of it with 2 of the 4x4s. And the last step is to secure it with Mefix, in which I can take off my sterile gloves, wash my hands, and in future clinical practice, I'll be more careful when applying the Mefix, in which